The symptoms of chronic opium use were often debilitating. Beyond the physical dependence, users would suffer from severe constipation, extreme lethargy, weight loss, and a dulling of their mental faculties. Their lives would shrink, centered almost entirely around obtaining and consuming the drug, leading to neglect of family, work, and personal hygiene. The long-term effects on physical and mental health were devastating, often leading to a premature death from overdose, malnutrition, or related illnesses. It's a slow, agonizing decline, a life gradually consumed by the drug's relentless grip. Hey guys, tonight we're stepping back into a world where a doctor's visit might have left you feeling worse. And the remedies on offer were less about healing and more about, well, slow, agonizing demise. Imagine yourself in a bustling Victorian city, the air thick with coal smoke and the faint, unsettling scent of carbolic acid. You're feeling a bit under the weather, perhaps a persistent cough, a touch of the vapors, or simply that vague, unsettling malaise that seems to cling to the damp, cobbled streets. You seek relief, and the local apothecary, with their rows of gleaming bottles and mysterious powders, seems like the obvious choice. But as you consider the concoctions they might prescribe, a shiver runs down your spine, because in this era the line between medicine and poison was often blurry, and sometimes entirely non-existent. Let's be honest, if you were around back then, you probably wouldn't survive the treatments, let alone the illness. So, before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here. And as you settle in, let me know in the comments where you're listening from, and what time it is for you. Now, dim the lights. Maybe turn on a fan for that soft background hum, and let's ease into tonight's journey together. The eventual efforts to control opium use were a gradual process, driven by growing awareness of its addictive nature and the social problems it caused. The Pharmacy Act of 1868, for instance, began to regulate the sale of certain poisons, including opium. But it was far from a complete ban, and many loopholes remained. It took decades of public health campaigns, medical advancements offering safer pain relief, and changing social attitudes to finally curb the widespread, casual use of opium. But its legacy as a pervasive, devastating force lingered, a testament to the dangers of unregulated substances and the desperate human need for escape. You can almost feel the heavy, sweet scent of opium in the air, a phantom comfort that once promised solace but delivered only chains. You find yourself navigating the labyrinthine alleys of a Victorian metropolis, the gas lamps casting long, dancing shadows that seem to stretch and distort reality. The air is thick, not just with fog and soot, but with an underlying current of desperation and a fervent, almost childlike, belief in the power of potions and panaceas. It's an age of rapid industrialization, of grand scientific discoveries, yet also an age where medical understanding lagged far behind the burgeoning complexities of urban life. Disease, often born from squalor and ignorance, stalked the populace, and the prevailing medical theories were, to put it mildly, a fascinating blend of ancient wisdom, burgeoning chemistry, and outright conjecture. You might hear whispers of miasma theory, the belief that diseases were caused by bad air, which, while incorrect, at least prompted some efforts at sanitation, albeit often misguided ones. As the sweet, heavy scent of opium begins to dissipate, a new, sharper aroma prickles at your senses, something invigorating, almost electric, yet with an underlying edge of danger. This is the scent of cocaine, a substance that, in the latter half of the Victorian era, emerged from the shadows of exotic plants to become a celebrated cure-all. A common historical fact found in tonics, elixirs, and even beverages. Far from being seen as a dangerous narcotic, cocaine was initially hailed as a miracle drug, a potent stimulant that promised to banish fatigue, elevate mood, and even cure the very opium addiction that plagued so many. It was the ultimate pick-me-up, a jolt of pure energy in a world often weighed down by illness and drudgery. Imagine you're suffering from a persistent headache, a common affliction in a world filled with poor ventilation, loud noises, and questionable diets. You might consult a physician, a man often trained in the classical arts as much as in medicine, whose diagnostic tools are limited to observation, palpation, and a good deal of guesswork. He might prescribe a calomel pill, a compound of mercury, believing it would purge the body of harmful humors. You swallow the small white tablet, perhaps noting a metallic taste on your tongue, and hope for the best. Little do you know, you've just ingested a heavy metal, one that will slowly, insidiously, begin to wreak havoc on your nervous system, your teeth, and your very sanity. It's a bitter pill indeed, and not just in taste. You might be a weary intellectual, burning the midnight oil, striving to keep pace with the rapid advancements of the age. Your mind feels sluggish, your thoughts clouded, and the endless hours of study are taking their toll. You see an advertisement for Vin Mariani, a popular tonic wine, endorsed by popes, presidents, and royalty, boasting its invigorating properties. What you don't realize is that this wine, a common historical fact, was infused with coca leaves, delivering a potent dose of cocaine with every sip. You take a glass, and almost immediately, a surge of clarity and energy washes over you. Your thoughts become sharper, your fatigue vanishes, and you feel an almost boundless capacity for work. It's like plugging yourself directly into the mains. A powerful, exhilarating rush, but one that comes with a very real risk of overload. The Victorians, bless their earnest, misguided hearts, were nothing if not enthusiastic experimenters. They lived in a world where the scientific method was still finding its footing, and the immediate, observable effect often trumped long-term consequences. If a substance made you feel something, a rush, a calm, a violent expulsion from both ends, it was often deemed effective. The concept of a placebo was largely unknown, and the power of suggestion, combined with the sheer desperation of the ill, made many a dubious remedy seem miraculous. It's like trying to fix a leaky roof with a teacup. It might catch a few drips, but it's not addressing the fundamental problem, and you're probably just making a bigger mess. Imagine you are a physician, eager to embrace the latest scientific breakthroughs. You've heard whispers of this remarkable new substance, isolated from the coca plant, that can numb pain and stimulate the nervous system. You begin to experiment, perhaps using it as a local anesthetic for minor surgeries or dental procedures. The results are astonishing. Patients experience profound pain relief, allowing for more complex and less agonizing interventions. You might even prescribe it for your patients suffering from nervous exhaustion or depression, believing you are offering them a genuine path to recovery. The initial successes are so compelling that the potential for addiction or long-term harm seems almost unthinkable. You wander into a chemist's shop, a place that feels less like a sterile pharmacy and more like an alchemist's den. Jars of dried herbs sit alongside bottles labeled with ominous Latin names. The air is thick with the scent of camphor, spirits, and something faintly acrid. Here, you might inquire about a tonic for nervous debility, a catch-all term for everything from anxiety to fatigue, common complaints in an age of strict social norms and relentless industrial grind. The chemist, a man with spectacles perched on his nose and a perpetually stained apron, might recommend a bottle of Dr. C. Williams' pink pills for pale people. You glance at the label, perhaps drawn in by the cheerful pink hue, unaware that these pills, while containing some iron, also often contained arsenic, a potent poison. The initial boost of energy you might feel is less about healing, and more about your body reacting to a low dose of a toxin, a kind of chemical shock therapy. It's a bit like trying to wake up by hitting yourself with a hammer. You'll definitely be awake, but perhaps not in the way you intended. The insidious nature of cocaine addiction, much like opium, was initially overlooked or attributed to individual weakness, rather than the drug itself. The immediate euphoria and heightened sense of well-being it provided were so appealing that the subsequent crash, the intense cravings, and the psychological dependence were often dismissed as minor inconveniences. People would develop a tolerance, chasing that initial high, leading to increasingly erratic behavior, paranoia, and a profound deterioration of their mental and physical health. You might observe a friend, once vibrant and energetic, becoming increasingly agitated, their eyes darting, their speech rapid and disjointed. They might suffer from insomnia, weight loss, and a growing sense of persecution, symptoms often attributed to hysteria or moral weakness, rather than the true culprit. It's a bit like trying to solve a puzzle with a piece that doesn't fit. You keep forcing it, but it only breaks the whole picture. The sheer ubiquity of dangerous chemicals in everyday life is astonishing. You might find arsenic in your wallpaper, lead in your paint, and mercury in your hat-making process. The Industrial Revolution, while bringing unprecedented prosperity, also ushered in an era of widespread environmental and personal contamination. People were exposed to these substances not just through medicine, but through their homes, their workplaces, and even their clothing. Imagine a fashionable lady, resplendent in a vibrant green dress, unaware that the vivid hue is achieved with arsenic-based dyes, slowly poisoning her skin. Or a gentleman, his face pale and drawn, suffering from the effects of lead in his pipes, believing his malaise is simply a sign of the times. Historians still debate whether the widespread use of these toxic substances significantly contributed to the overall shorter lifespans and chronic illnesses prevalent in the Victorian era. Beyond the obvious issues of sanitation and nutrition, it's a complex tapestry of cause and effect, woven with threads of ignorance and unintended consequences. Consider the widespread belief in cocaine's ability to cure opium addiction, an ironic and tragic common historical fact. Many who sought relief from their laudanum habit were prescribed cocaine, unwittingly trading one powerful addiction for another, often more destructive. 1. You might know someone who, after years of struggling with opium, turns to cocaine with desperate hope, only to find themselves ensnared in an even more relentless cycle of craving and despair. The initial burst of energy and mental clarity that cocaine provided could temporarily mask the withdrawal symptoms of opium, creating a false sense of liberation, but ultimately deepening the user's dependence on powerful substances. It's like trying to escape a sinking ship by jumping into a shark-infested ocean. You might get away from the immediate danger, but you're still in a perilous situation. Consider the common cold, a nuisance then as now. Instead of chicken soup and rest, you might be advised to inhale fumes from a mixture of carbolic acid and water, or to apply a mustard plaster to your chest, a concoction so irritating it often caused blisters. The logic was often based on the idea that if it caused a strong reaction, it must be doing something. This heroic medicine approach, where aggressive treatments were favored, often left patients weaker, not stronger. It's the medical equivalent of trying to fix a minor scratch with a sledgehammer. Sure, the scratch is gone, but so is your hand. The academic debate surrounding cocaine's early medical applications is particularly fascinating. While its anesthetic properties were quickly recognized and revolutionized surgery, historians still debate whether its widespread use as a general tonic or mood enhancer ever truly offered any genuine therapeutic benefit beyond temporary symptomatic relief, or if its perceived efficacy was primarily due to its powerful stimulant effects and the placebo phenomenon. Some argue that in an era lacking effective psychotropic medications, cocaine offered a crude but immediate solution for mental and emotional distress. Others contend that its widespread prescription for conditions like depression and fatigue was a clear example of medical overreach, causing far more harm than good. It's a bit like arguing whether a rocket-powered unicycle is a good mode of transport. It might be fast, but it's incredibly unstable. Even seemingly innocuous remedies could be laced with peril. Teething powders for infants, designed to soothe their discomfort, often contained mercury or opium, leading to countless cases of accidental poisoning. You might see a mother administering a spoonful of Godfrey's cordial to her crying baby, believing she is providing comfort, unaware that she is slowly sedating her child with a potent opiate. The silence that follows might be a blessing for the exhausted parent, but for the infant, it could be a step closer to a tragic end. This casual administration of powerful narcotics to children is an obscure detail that highlights the stark differences in medical ethics and understanding between then and now. You might see a dentist, a common historical fact, applying a cocaine solution directly to a patient's gums before extracting a tooth. The patient, who moments before was bracing for agonizing pain, now feels only a dull pressure, a profound relief that seems nothing short of miraculous. This revolutionary use of cocaine as a local anesthetic, first demonstrated by Carl Koller in 1884, quickly transformed surgical and dental practices, making previously excruciating procedures far more bearable. This specific application of cocaine, initially seen as a purely beneficial medical advancement, stands in stark contrast to its later widespread recreational abuse, an obscure detail that highlights the complex and often unpredictable trajectory of scientific discovery. The lack of regulation was a significant factor in the proliferation of these dangerous cures. Anyone could set themselves up as a purveyor of remedies, often making outlandish claims with no scientific basis. Quack doctors and traveling salesmen hawked their wares in town squares, promising miraculous recoveries from every ailment imaginable. You might stumble upon a lively demonstration, a charismatic figure extolling the virtues of his electric belt for curing rheumatism, or a universal elixir guaranteed to restore youth and vitality. These charlatans preyed on the desperate and the uneducated, their silver tongues often more effective than their dubious medicines. It's a reminder that even in an age of progress, human vulnerability to false promises remains a constant. The sheer proliferation of cocaine-laced products in the Victorian marketplace is astonishing. Beyond the tonic wines, you could find cocaine in throat lozenges, nasal sprays, and even in popular soft drinks. Remember that famous cola drink, originally marketed as a brain tonic? It contained coca leaf extract, a common historical fact, though the amount of active cocaine was later reduced and eventually removed. Imagine walking into a chemist and seeing shelves lined with various remedies, all promising to cure your ailments, many of them containing this powerful stimulant. It's a thought that makes you pause. The casual availability of a substance we now recognize as highly addictive and dangerous. The prevailing understanding of the human body was also a major hurdle. Germ theory was still in its infancy, and the concept of microscopic pathogens was largely dismissed or unknown. Without this fundamental understanding, treatments were often based on symptoms rather than root causes. If you had a fever, you were likely bled, a practice that involved removing blood from the body, often with leeches, in the belief that it would remove impurities. This might, of course, only weaken the patient further, making them more susceptible to infection. It's like trying to put out a fire by throwing gasoline on it, a truly counterproductive approach. The symptoms of chronic cocaine use were often severe and terrifying. Beyond the physical toll of insomnia, malnutrition, and cardiovascular issues, users would experience profound psychological disturbances. Paranoia, hallucinations, and delusions were common, leading to erratic and sometimes violent behavior. The cocaine bugs, a sensation of insects crawling under the skin, was a particularly distressing hallucination, driving users to scratch and pick at their flesh. It's a descent into a waking nightmare, a mind tormented by its own chemical imbalances. Yet, amidst this dangerous landscape, genuine medical progress was slowly, painstakingly being made. The development of anesthesia, the pioneering work of figures like Florence Nightingale in nursing and sanitation, and the gradual acceptance of germ theory began to chip away at the edifice of outdated and harmful practices. But for the average Victorian, seeking medical help was often a roll of the dice, a gamble with their health and their very life. The belief in the power of strong, often toxic, substances lingered, a testament to the desperate desire for relief in a world where illness was a constant, terrifying companion. You can almost hear the faint, melancholic strains of a street organ playing in the distance, a somber soundtrack to an era of both remarkable innovation and profound medical ignorance. The eventual recognition of cocaine's addictive and destructive properties was a slow and painful process. As cases of addiction and psychosis mounted, the medical community began to reevaluate its initial enthusiasm. Public awareness campaigns and growing scientific understanding gradually led to stricter regulations and, eventually, the criminalization of cocaine for non-medical use. But its legacy, much like opium, lingered, a stark reminder of the dangers of powerful substances introduced without full understanding of their long-term effects. You can almost feel the faint, exhilarating buzz of cocaine in the air, a phantom promise of boundless energy that ultimately delivered only despair. You step further into the dimly lit, gas lamp-lit streets, the shadows lengthening and twisting around you like spectral figures. The air, still damp and heavy, carries the scent of damp earth and distant factory smoke. But now, a new, more unsettling aroma seems to cling to your senses, a faint, metallic tang, almost sweet, yet undeniably sinister. This is the subtle, pervasive presence of mercury, a substance that, for centuries, held a paradoxical position in the human imagination, a shimmering liquid metal, both fascinating and fearsome, promising miraculous cures while delivering a slow, agonizing descent into madness. As the stimulating scent of cocaine fades into the background, a new, more acrid and unsettling aroma begins to permeate the air. The sharp, biting smell of corrosive chemicals, substances that blurred the line between household cleaner and medical treatment. In the Victorian era, as cities grew and sanitation became a pressing concern, powerful disinfectants and caustic compounds became commonplace, not just for cleaning drains and sanitizing hospitals, but also, alarmingly, for treating a variety of ailments, often with devastating consequences. It was a time when the power of a strong chemical was equated with its efficacy, leading to the application of truly dangerous substances to the human body. You recall the calomel pill you might have swallowed earlier, a seemingly innocuous white tablet? But that was just one facet of mercury's insidious reach. In the Victorian era, mercury, often referred to as quicksilver, was a medical superstar, lauded for its purgative, antiseptic, and anti-syphilitic properties. If you suffered from almost anything, from constipation to consumption, from gout to gonorrhea, chances are mercury was on the menu. Doctors, often operating under the humoral theory of medicine, believed that illness was caused by an imbalance of bodily fluids. Mercury, with its powerful emetic and laxative effects, was thought to be the ultimate rebalancer, capable of purging the body of its perceived impurities. It was the ultimate detox, if you will, though the detox process itself was often far more harmful than the toxins it aimed to expel. It's like trying to clean your house by setting it on fire. Sure, all the dust is gone, but so is the house. You might be walking past a public hospital, the air thick with the distinct, pungent odor of carbolic acid, a common historical fact used as a potent antiseptic by figures like Joseph Lister, who pioneered antiseptic surgery. While Lister's work revolutionized surgical hygiene and saved countless lives, the enthusiastic adoption of carbolic acid extended far beyond the operating theater. You might hear of it being used to sterilize wounds, yes, but also to treat skin conditions, internal infections, and even as a gargle for sore throats. The logic was simple. If it killed germs on surfaces, it must kill germs inside the body too. It's like trying to clean a delicate antique with a sandblaster. It might get rid of the dirt, but it will also destroy the antique. Imagine you're afflicted with syphilis, a widespread and devastating disease in the Victorian era, carrying with it not only immense physical suffering, but also profound social stigma. For centuries, mercury had been the go-to treatment, a common historical fact that speaks volumes about the desperation of the times. You might undergo a mercurial cure, which could involve anything from ingesting mercury compounds to applying mercury-laced ointments to your skin, or even sitting in a mercury vapor bath, allowing the fumes to permeate your pores. You endure the profuse salivation, the metallic taste, the loosening of your teeth, the painful ulcers in your mouth, and the tremors that begin to ripple through your limbs, all in the desperate hope of ridding yourself of the disease. The logic, however flawed, was that if the mercury caused such a violent reaction, it must be attacking the illness with equal ferocity. It was a brutal bargain, trading one form of suffering for another, often more debilitating. Imagine you are suffering from a persistent skin ailment, perhaps a stubborn eczema or a fungal infection, causing you immense discomfort and social embarrassment. Your doctor, or perhaps a well-meaning neighbor, might recommend a diluted solution of carbolic acid to be applied directly to the affected area. You dab the liquid onto your skin, feeling an immediate burning sensation, followed by a temporary numbing. For a brief period, the irritation might even seem to lessen, as the acid destroys the superficial layers of skin and any microorganisms present. But over time, you might develop severe chemical burns, blistering, and even systemic poisoning as the chemical is absorbed through your skin, leading to dizziness, headaches, and kidney damage. The pursuit of relief often led to an even more painful and dangerous condition. The insidious nature of mercury poisoning is its slow, cumulative effect. You might not feel immediate alarm, perhaps a subtle tremor in your hand, a slight difficulty in articulating your thoughts, a growing irritability that you attribute to the stresses of daily life. But as the mercury accumulates in your system, it begins to attack your nervous system, your kidneys, and your brain. You might develop erethism, a peculiar neurological disorder characterized by extreme shyness, irritability, tremors, and a profound loss of memory. This condition was so prevalent among hat makers, who used mercury nitrate to process felt, that it gave rise to the phrase "mad as a hatter," an obscure detail that perfectly encapsulates the occupational hazards of the era. You see the vacant stares, the trembling hands, the sudden outbursts of anger in those around you, and you wonder if it's simply the strain of modern life, or something far more sinister at play. The insidious nature of these corrosive treatments lay in their immediate, dramatic effect, which was often mistaken for healing. If a substance caused a strong reaction, a burning sensation, a peeling of skin, a violent purge, it was often perceived as working. The long-term damage, the internal corrosion, and the systemic toxicity were often overlooked or attributed to the underlying illness. You might observe a patient, their skin raw and inflamed from a caustic application, yet their physician remains convinced that the treatment is effective, believing the visible irritation is simply the body purging the disease. It's a bit like trying to fix a broken vase by smashing it into smaller pieces. It's certainly a change, but not a repair. Consider the common digestive complaint, dyspepsia or indigestion, a frequent companion to the rich, heavy Victorian diet. Your doctor might prescribe a regular dose of blue mass, a mixture of mercury and chalk, rolled into pills. You dutifully take your daily dose, believing it to be a harmless digestive aid. For a time, you might even feel a temporary improvement, perhaps due to the powerful laxative effect clearing your system. But beneath the surface, the mercury is silently doing its work, eroding your health. You might experience chronic fatigue, unexplained weight loss, and a general feeling of malaise that no amount of rest seems to alleviate. It's a bit like trying to fix a leaky faucet by constantly bailing out the water. You might keep the floor dry for a bit, but the leak is still there. Getting worse. Consider the use of strong alkalis, such as lye or caustic soda, for various internal complaints. While less common than acids, these were sometimes employed as extreme purgatives, or for treating conditions like diphtheria, where a strong caustic solution might be applied to the throat to burn away the pseudomembrane. You can almost feel the searing pain, the choking sensation, as such a substance touches delicate mucous membranes. The desperation for a cure in the face of deadly diseases led to truly horrifying interventions. This use of highly corrosive substances internally is an obscure detail that truly underscores the extreme measures taken in Victorian medicine. The widespread use of mercury wasn't confined to the medical profession. It permeated various industries, exposing countless individuals to its toxic embrace. Mirror makers, gilders, and photographers all worked with mercury, often without adequate ventilation or protective measures. You might walk past a workshop, catching a glimpse of a craftsman meticulously applying a mercury amalgam to a mirror, the air thick with invisible, poisonous vapors. These workers, often unaware of the long-term consequences, would slowly succumb to the tremors, the cognitive decline, and the eventual madness that characterized mercury poisoning. The irony is that the very substances that brought beauty and convenience to Victorian life were often the ones silently destroying the lives of those who produced them. The academic debate surrounding the use of carbolic acid and other strong antiseptics in Victorian medicine is complex. While Lister's pioneering work with carbolic acid in surgery was undeniably life-saving and marked a turning point in medical history, historians still debate the precise balance between its benefits and the risks of its broader, less controlled application. Some argue that despite its toxicity, carbolic acid, even in its more general uses, offered a crude but often effective means of combating infection in an era before antibiotics. Others contend that its widespread and sometimes indiscriminate use outside of sterile surgical environments led to significant harm, including accidental poisonings and severe chemical burns, outweighing its perceived benefits. It's like arguing whether a fire extinguisher is good for putting out a candle. It works, but it's overkill and potentially dangerous. The academic debate surrounding mercury's role in Victorian medicine is complex. While its toxicity is undeniable, historians still debate whether the benefits, however temporary or illusory, sometimes outweighed the risks in certain acute conditions, especially before the advent of more effective treatments. Some argue that in cases of severe syphilis, for instance, mercury might have offered some palliative relief, even if it didn't cure the underlying disease and caused severe side effects. Others contend that its use was almost always detrimental, a testament to the era's medical ignorance. It's a bit like arguing whether a band-aid on a gaping wound is better than nothing. It might offer a tiny bit of comfort, but it's hardly a solution. You might see a patient suffering from a severe cough or bronchitis being treated with creosote, a common historical fact derived from wood tar, which was related to carbolic acid. This dark, oily liquid, with its strong, smoky smell, was often prescribed as an expectorant and antiseptic for respiratory ailments. You might inhale its fumes, feeling a burning sensation in your nostrils and throat, believing it's clearing your lungs. While it might have offered some temporary relief by irritating the mucous membranes and promoting coughing, prolonged exposure could lead to kidney damage, digestive issues, and nervous system disorders. It was a treatment that promised to clear your chest but could silently poison your organs. You might observe a child, pale and listless, suffering from worms, a common ailment in an age of poor hygiene. The doctor, with a solemn nod, might prescribe a dose of calomel, believing it would expel the parasites. The child endures the violent vomiting and diarrhea, and for a time appears to improve. But the long-term damage to their developing nervous system is already being done. The casual administration of such potent substances to vulnerable populations, particularly children, is a truly chilling aspect of Victorian medicine, a stark reminder of the ethical blind spots of the era. It's an obscure detail that highlights the tragic consequences of good intentions coupled with a profound lack of understanding. The sheer volume of these industrial chemicals available and their casual integration into medical practice is astonishing. Apothecaries would stock large carboys of carbolic acid, alongside other potent compounds, often with minimal safety precautions. The lack of clear labeling, dosage instructions, and understanding of long-term toxicity meant that these dangerous substances were handled and administered with a shocking degree of nonchalance. Imagine a chemist casually pouring a strong acid from a large jar into a small bottle, perhaps without gloves or protective eyewear, a common sight in the unregulated environment of the era. It's a thought that makes you wince. The sheer disregard for personal safety in the name of perceived healing. The sheer volume of mercury prescribed is staggering. Imagine the countless vials and bottles, the endless stream of pills and ointments, all containing this shimmering, deadly liquid. The apothecaries, with their scales and mortars, would have spent their days meticulously weighing and mixing mercury compounds, their hands perhaps stained with its residue. The widespread availability and acceptance of mercury as a cure-all meant that almost every household would have had some form of it in their medicine cabinet, a silent killer lurking amongst the more benign remedies. It's a thought that sends a shiver down your spine. The idea that your own ancestors might have been unknowingly poisoning themselves in the pursuit of health. The symptoms of corrosive chemical poisoning were often immediate and dramatic, but their full extent could be delayed. Internal burns, severe pain, vomiting, and shock would follow ingestion, while external applications could lead to deep tissue damage and necrosis. For chronic exposure, the symptoms might be more subtle: persistent digestive issues, kidney dysfunction, and neurological problems. The body, constantly battling the corrosive effects, would slowly break down, its vital organs compromised. It's a truly agonizing way to suffer, a slow internal fire that consumes you from within. The symptoms of mercury poisoning were often misinterpreted or attributed to other causes. The tremors might be put down to nerves, the memory loss to old age, and the irritability to a difficult temperament. This misdiagnosis meant that victims often continued to be exposed to mercury, exacerbating their condition. It's a cruel twist of fate, where the very symptoms of the poisoning reinforced the belief that the cure was still needed. You see the subtle changes in your loved ones? A friend who becomes increasingly withdrawn? A relative whose hands tremble uncontrollably? And you chalk it up to the hardships of life, never suspecting the silent assailant within their own medicine. The eventual decline in the use of highly corrosive chemicals for internal or broad external medical application was driven by a growing understanding of pharmacology, toxicology, and the development of safer, more targeted antiseptics and medications. The medical community gradually recognized that while these substances might kill pathogens, they also killed healthy tissue and caused severe systemic damage. This shift marked a crucial step towards a more nuanced and less brutal approach to medicine, moving away from the heroic treatments that often inflicted as much harm as the diseases they sought to cure. You can almost hear the faint, echoing sizzle of acid on skin, a chilling reminder of an era when the cure could be as terrifying as the illness. The sharp, acrid smell seems to dissipate, leaving behind a lingering sense of relief that we live in a different time. The transition away from mercury as a primary treatment was slow and fraught with resistance. Doctors, having relied on it for centuries, were often reluctant to abandon a substance they believed to be effective. It took the accumulation of overwhelming evidence, the rise of more scientific approaches to medicine, and the eventual understanding of its profound toxicity to finally relegate mercury to the realm of dangerous historical curiosities. But even then, its legacy lingered, a testament to the enduring power of tradition and the slow, arduous march of scientific progress. You can almost hear the faint, echoing cries of those who suffered, a somber reminder of the price paid for medical ignorance. The metallic tang in the air seems to dissipate, but the chilling realization of mercury's pervasive influence remains. As the acrid scent of industrial chemicals begins to fade, a more earthy, sometimes pungent, aroma takes its place. This is the complex and often deceptive scent of the natural world, specifically the potent plants that, for centuries, formed the backbone of medicine, yet often held within their leaves, roots, and berries the power to heal or to kill. In the Victorian era, the line between herbal remedy and deadly poison was incredibly fine, and the fine art of administering deadly natural compounds was a skill that often meant the difference between recovery and a tragic end. It was a time when botanical knowledge was both a source of healing and a potential instrument of demise. You find yourself drawn deeper into the hushed, gas-lit world of Victorian society, where appearances often masked grim realities. The metallic tang of mercury has faded, replaced by something more subtle, yet equally pervasive, a faint, almost sweet, almond-like scent. Barely perceptible, but hinting at a deadly secret. This is the scent of arsenic, the king of poisons, a substance so potent and so readily available that it became a silent partner in both medicine and murder. In the Victorian era, arsenic was not just a tool for the nefarious. It was woven into the very fabric of daily life. From the vibrant colors on your walls to the health tonics on your bedside table, you might be visiting a rural village far from the bustling city, where traditional remedies still hold sway. The local wise woman, or herbalist, a common historical fact, might offer you a decoction made from foxglove leaves for your ailing heart. What you wouldn't know is that foxglove, the source of digitalis, a powerful cardiac glycoside, has a very narrow therapeutic window. A slightly too large dose, or even a batch with a higher concentration of the active compounds, could easily tip the balance from life-saving medicine to fatal poison. You swallow the bitter liquid, hoping for relief, unaware that your very heartbeat is now dancing on the edge of a precipice. It's like trying to walk a tightrope across a chasm, one wrong step, and it's all over. You recall the pink pills for pale people mentioned earlier. A common historical fact that highlights the casual inclusion of dangerous substances in everyday remedies. These pills, often marketed to women suffering from anemia or a general lack of vitality, promised to restore a rosy complexion and robust health. You might have seen advertisements depicting radiant, healthy women, their cheeks flushed with a vibrant glow, all thanks to the magic of these little pink tablets. What these advertisements conveniently omitted, however, was that the magic often came from a small, carefully measured dose of arsenic. The idea was that a tiny amount of poison could stimulate the body, giving a temporary boost of energy and, ironically, a healthier appearance by dilating capillaries and bringing blood closer to the surface of the skin. It was a beauty regimen with a truly fatal flaw. It's like trying to make your car run faster by pouring sugar in the gas tank. It might give a quick burst, but you'll soon be calling for a tow. Imagine you are suffering from severe pain. perhaps from a chronic ailment or a recent injury. Your physician might prescribe a preparation containing belladonna, also known as deadly nightshade, a common historical fact used for its analgesic and antispasmodic properties. You might take a small pill, feeling the immediate relief as your pain subsides and your muscles relax. But belladonna, with its active compounds atropine and scopolamine, is a potent deliriant and poison. Too much, and you could experience hallucinations, delirium, a racing heart, and eventually respiratory failure. The very substance that offered comfort could plunge you into a terrifying, hallucinatory nightmare. Imagine you are a young woman, striving for the fashionable pale complexion that signified gentility and refinement in Victorian society. A suntan was considered vulgar, a sign of outdoor labor, and thus lower class. To achieve this ethereal pallor, you might turn to arsenic wafers or complexion washes laced with the deadly element. You diligently apply the wash, feeling a slight tingling sensation, believing you are enhancing your beauty. Over time, your skin might indeed become paler, almost translucent. But beneath the surface, the arsenic is slowly accumulating, causing internal damage. You might notice your nails becoming brittle, your hair thinning, and a persistent feeling of nausea. The pursuit of beauty, in this era, was often a perilous journey, paved with toxic intentions. The insidious nature of plant-based poisons lay in their variability and the lack of standardized dosages. Unlike refined chemical compounds, the potency of a plant could vary wildly depending on the growing conditions, the part of the plant used, and the method of preparation. This made precise dosing almost impossible, turning every administration into a dangerous gamble. You might observe a doctor carefully measuring out a tincture, his brow furrowed in concentration, knowing that a single drop too many could be lethal. It's a bit like trying to bake a cake without a recipe. Guessing at the amount of flour and sugar, the outcome is highly unpredictable and often inedible. The insidious nature of arsenic poisoning lies in its mimicry of common ailments. The early symptoms, nausea, vomiting, diarrhea, abdominal pain, could easily be mistaken for a stomach bug or food poisoning. This made it a favorite tool for murderers, as its effects were difficult to distinguish from natural causes. But for those unknowingly ingesting it through remedies, the slow, chronic poisoning would manifest in more subtle, yet equally devastating ways. You might experience a tingling sensation in your fingers and toes, a sign of peripheral neuropathy, or a persistent cough that never seems to go away. These symptoms, often vague and nonspecific, would be dismissed as minor complaints, or attributed to the general nervousness of the age. Consider the use of hemlock, a common historical fact, for its sedative and antispasmodic properties. Despite its infamous reputation as the poison that killed Socrates, while rarely used intentionally in medicine due to its extreme toxicity, accidental poisonings from misidentification were not unheard of. You might forage for wild herbs, believing you are gathering a beneficial plant, only to inadvertently pick hemlock, its innocent-looking leaves masking a deadly secret. The symptoms, progressive muscle weakness, paralysis, and eventually respiratory arrest, would unfold with terrifying speed, a grim reminder of nature's unforgiving power. It's a truly chilling thought that a walk in the countryside could lead to such a swift and silent demise. Consider the common tonic, a staple in many Victorian households. Prescribed for everything from fatigue to fever, these tonics, often alcohol-based, were frequently fortified with arsenic, believed to be a powerful stimulant and restorative. You might take a spoonful of such a tonic daily, convinced it's bolstering your health and warding off illness. For a brief period, you might even feel more energetic, a false sense of well-being induced by the toxin. But as the weeks turn into months, you might develop dark spots on your skin, particularly on your palms and soles, a condition known as arsenical keratosis, an obscure detail that served as a grim telltale sign of prolonged exposure. It's a bit like trying to boost your computer's performance by installing malware. It might seem faster at first, but it's slowly destroying your system from the inside out. The academic debate surrounding the true efficacy and safety of many traditional plant-based remedies in the Victorian era is complex. While some plants, like foxglove, contained genuinely active compounds that were later isolated and refined into modern drugs. Historians still debate whether the benefits of their crude preparations outweighed the risks of their inherent toxicity and unpredictable potency. Some argue that traditional herbalists, through generations of trial and error, developed a nuanced understanding of these plants, minimizing harm through careful preparation and observation. Others contend that the vast majority of plant-based remedies were ineffective at best and actively dangerous at worst, with any perceived benefits being largely due to placebo effects. It's like arguing whether a wild mushroom is edible or poisonous without a guide. It might look harmless, but the consequences could be fatal. Arsenic's presence extended far beyond medicine and cosmetics. It was a ubiquitous pigment, particularly in the vibrant green known as Scheele's green or Paris green. This striking color, so popular in fashion and home decor, was a literal poison. You might admire the lush green wallpaper in a drawing room, unaware that every time the room became damp, the arsenic-laced pigment could release toxic fumes into the air, slowly poisoning the inhabitants. Or perhaps you attend a ball, and a lady sweeps past in a breathtaking green gown, the fabric shimmering under the gaslight, oblivious to the fact that the very dyes in her dress are causing skin irritation and potentially more serious ailments. The irony is that the very colors that brought vibrancy and beauty to Victorian homes and clothing were often the ones silently destroying the lives of those who lived amongst them. You might see a patient suffering from severe stomach cramps or an intestinal blockage, being given a strong purgative derived from croton oil, an obscure detail that was a powerful irritant and laxative derived from the seeds of the croton plant. You would endure the violent, excruciating bowel movements, believing that the expulsion was a necessary part of the healing process. While it certainly cleared the bowels, its extreme irritant properties could cause severe inflammation, dehydration, and even internal damage, leaving the patient weaker and more vulnerable. It was a treatment that promised to clear your system but could leave your insides ravaged. The academic debate surrounding arsenic's medical efficacy is particularly contentious. While its use in small doses for certain skin conditions or as a general tonic was widespread, historians still debate whether it ever truly offered any genuine therapeutic benefit, or if any perceived improvements were merely placebo effects or transient physiological reactions to the poison. Some argue that in the absence of effective alternatives, doctors were simply doing the best they could with the knowledge available, and that arsenic, in some cases, might have been seen as a lesser evil compared to the progression of certain diseases. Others vehemently contend that its widespread use was a clear example of medical malpractice, causing far more harm than good. It's a bit like arguing whether a broken clock is right twice a day. Even if it occasionally seems to work, it's fundamentally flawed. The sheer variety of potent plants utilized in Victorian medicine is vast. From digitalis to belladonna, from ergot to aconite wolfsbane, the apothecary's shelves were filled with dried herbs, tinctures, and extracts, each holding the potential for both healing and harm. The knowledge of these plants was often passed down through generations, a blend of folklore, empirical observation, and nascent scientific understanding. Imagine the sheer volume of plant material, harvested from fields and forests, then carefully processed and prepared, each batch a unique chemical cocktail. It's a thought that underscores the precarious nature of medicine in an era before chemical synthesis and rigorous standardization. You might see a child, suffering from a persistent cough or asthma, being given Fowler's solution, a common historical fact that was a solution of potassium arsenite. This remedy, widely prescribed, was thought to alleviate respiratory ailments. The child, perhaps too young to voice their discomfort effectively, would suffer the internal burning sensation and the gradual systemic poisoning. The casual administration of such a potent poison to children, often for chronic conditions, is a truly disturbing aspect of Victorian medicine, highlighting the desperate measures taken in the face of widespread illness and limited understanding. It's an obscure detail that reveals the vulnerability of the young in an era of dangerous remedies. The symptoms of poisoning from these potent plants were as varied as the plants themselves, ranging from cardiac arrest and respiratory failure to severe neurological disturbances, hallucinations, and convulsions. The body's reaction could be swift and violent, or a slow, agonizing decline, depending on the plant, the dose, and the individual's susceptibility. Often, the symptoms would mimic the very illnesses they were meant to cure, making diagnosis a cruel game of chance. It's a truly terrifying thought that the very cure you sought could be the agent of your suffering, twisting your body and mind into unrecognizable forms. The sheer volume of arsenic produced and consumed in the Victorian era is staggering. Imagine the countless pounds of this white, odorless, tasteless powder, easily disguised in food or drink, making it the perfect tool for both accidental and intentional poisoning. Apothecaries would have stocked it, often alongside other common chemicals, making it accessible to anyone with a plausible reason for purchase. The widespread availability and its insidious nature meant that arsenic was a constant, silent threat, lurking in unexpected places, from the medicine cabinet to the pantry. It's a thought that sends a shiver down your spine. The idea that a substance so deadly was so casually integrated into daily life, the eventual shift away from crude plant extracts to isolated, standardized chemical compounds marked a significant turning point in medicine. As pharmacology advanced, scientists were able to identify the active ingredients in plants, synthesize them, and produce them in precise, measurable doses, greatly reducing the risk of accidental poisoning and improving therapeutic outcomes. This move towards standardization and scientific rigor gradually replaced the unpredictable and often dangerous art of administering raw botanical poisons. But the legacy of these potent plants lingers, a reminder of humanity's long and often perilous journey to understand and harness the power of nature for healing. You can almost smell the faint, bitter aroma of dried herbs, a phantom presence from an era where the garden could be both a pharmacy and a graveyard. The symptoms of chronic arsenic poisoning were often mistaken for other diseases, or simply attributed to a general decline in health. The skin lesions might be diagnosed as eczema, the nerve damage as rheumatism, and the general malaise as neurasthenia. This misdiagnosis meant that victims often continued to be exposed to arsenic, exacerbating their condition and making their eventual demise all the more agonizing. It's a cruel irony, where the very signs of poisoning were misinterpreted, leading to continued exposure to the very substance causing the suffering. You see the gradual deterioration of a loved one, their skin mottled, their gait unsteady, their mind clouded, and you mourn their decline, never suspecting the hidden poison at work. As the earthy scent of potent plants fades, a new, more unsettling presence emerges. Not from a chemical or a botanical, but from the realm of human deception and desperate hope. This is the pervasive, often flamboyant, and ultimately cruel charade of quackery. A common historical fact that flourished in the unregulated landscape of Victorian medicine, in an era where genuine medical understanding was limited and effective treatment scarce. Charlatans and unscrupulous entrepreneurs stepped into the void, promising miraculous cures for every conceivable ailment, often with nothing more than sugar water, alcohol, and a healthy dose of showmanship. The eventual decline in arsenic's medical use was a slow and arduous process, driven by a growing understanding of its toxicity and the development of more effective and safer treatments. But its legacy as a ubiquitous, dangerous chemical lingers, a testament to an era where the pursuit of health and beauty often came at a terrifying cost. You can almost hear the faint, rustling sound of a Victorian gown, its vibrant green hue a silent scream of hidden danger, a somber reminder of the price paid for ignorance. The faint almond scent in the air seems to dissipate, but the chilling realization of arsenic's pervasive influence remains. You might find yourself in a bustling town square, amidst a throng of curious onlookers, drawn by the booming voice of a traveling salesman. He stands on a brightly painted wagon, adorned with banners proclaiming his universal elixir or miracle restorative. He gestures wildly, his eyes gleaming with a practiced sincerity, as he recounts tales of impossible recoveries and testimonials from supposedly grateful patients. He promises to cure everything from consumption to rheumatism, from baldness to melancholia, all with a single bottle of his wondrous concoction. You listen, perhaps skeptical, but a flicker of hope ignites within you, a desperate desire for relief from your own nagging ailments. It's like watching a magician pull a rabbit from a hat. You know it's a trick, but you still want to believe. You continue your journey through the dimly lit corridors of Victorian medical history, the lingering sense of mercury and arsenic now fading, replaced by a more subtle yet equally pervasive threat. This is the silent, invisible enemy of lead, a heavy metal that permeated almost every aspect of Victorian life. From the pipes that delivered water to their homes, to the paints that adorned their walls and the cosmetics that graced their faces. Unlike the dramatic, acute effects of some other poisons, lead often worked its mischief slowly, insidiously, a creeping paralysis that could mimic a myriad of other ailments, making its diagnosis a constant challenge. Imagine you are a woman suffering from female complaints, a vague and often debilitating array of gynecological issues that were poorly understood and rarely discussed openly. You see an advertisement for Lydia Pinkham's vegetable compound, a common historical fact, promising to alleviate all your woes. You purchase a bottle as perhaps drawn in by the image of a kindly, matronly woman on the label. What you don't realize is that while it contained some herbal extracts, its primary active ingredient was often a significant amount of alcohol, offering a temporary sense of calm and well-being that was easily mistaken for genuine healing. The initial feeling of relief, the soothing warmth of the alcohol, was enough to convince many that the compound was indeed working wonders, even as their underlying conditions remained untreated. You might be sitting in a grand Victorian drawing room, admiring the freshly painted walls, their vibrant colors a testament to the era's burgeoning industrial capabilities. What you wouldn't know, however, is that many of these paints, particularly the popular white and yellow pigments, were heavily laden with lead. As the paint dried and aged, it would flake, releasing microscopic particles into the air, which could then be inhaled or ingested, especially by children who might chew on painted surfaces. This was a common historical fact, yet its devastating consequences were largely unrecognized for much of the era. It's like living in a house where the very air you breathe is slowly poisoning you, a truly terrifying thought. The insidious nature of quackery lay in its exploitation of human vulnerability and the lack of scientific literacy. In an age before rigorous clinical trials and government oversight, anyone could bottle a mixture of dubious ingredients, slap on a fancy label, and make outrageous claims. The testimonials, often fabricated or exaggerated, were powerful tools of persuasion, preying on the desperate hope of the ill. You might observe a man, his face etched with pain, eagerly purchasing a rheumatism cure from a traveling charlatan, clutching the bottle as if it were a lifeline. The placebo effect, combined with the natural waxing and waning of many chronic conditions, meant that some individuals might genuinely feel better, further fueling the belief in these fraudulent remedies. It's a bit like trying to win the lottery by buying every ticket. You might get lucky once, but it's not a sustainable strategy. Imagine you are a child in a wealthy Victorian household, surrounded by beautifully painted toys and furniture. You might spend hours playing, occasionally putting your hands, or even the toys themselves, into your mouth, a natural curiosity for a young one. Unbeknownst to you, each touch, each taste, is a tiny dose of lead, slowly accumulating in your developing body. You might become irritable, restless, or suffer from unexplained stomach pains, symptoms often dismissed as typical childhood maladies or naughtiness. The long-term effects, however, could be far more severe developmental delays, learning disabilities, and even irreversible brain damage. The very objects designed to bring joy and comfort were, in many cases, silent agents of destruction. Consider the electric belts and magnetic cures that were all the rage. A common historical fact that promised to harness the mysterious power of electricity or magnetism to restore health. These devices, often nothing more than simple batteries or magnets encased in fabric, were marketed as cures for everything from impotence to paralysis. You might strap on an electric belt, feeling a faint tingling sensation, convinced that the invisible currents are invigorating your body and banishing your ailments. The scientific jargon used in their advertisements, though utterly meaningless, lent an air of credibility to these utterly useless devices. It's a truly fascinating example of how easily people could be swayed by the promise of cutting-edge technology, even when it was pure bunk. The insidious nature of lead poisoning, or plumism as it was sometimes called, was its wide range of non-specific symptoms. A persistent headache, fatigue, constipation, joint pain, and a general feeling of malaise could all be signs of lead exposure. Yet they could also be attributed to a myriad of other common Victorian ailments. This made diagnosis incredibly difficult, often leading to misinterpretations and ineffective treatments. You might consult a physician for your chronic stomach cramps, and he might prescribe a purgative or a change in diet, never suspecting that the very water you drink or the paint on your windowsills is the true culprit. It's a bit like trying to find a needle in a haystack, when the haystack itself is made of needles. The academic debate surrounding the overall impact of quackery on Victorian public health is multifaceted. While it's clear that many patent medicines were ineffective and some actively harmful, historians still debate the extent to which they delayed or prevented individuals from seeking legitimate medical care. Some argue that in an era where conventional medicine often offered little more than harsh purges and dangerous chemicals, patent medicines, with their often milder ingredients and psychological comfort, might have sometimes been a lesser evil, or at least provided some form of palliative care. Others contend that quackery was a significant public health menace, draining the pockets of the poor and vulnerable, and actively contributing to prolonged suffering and premature death by offering false hope. It's like arguing whether a broken compass is worse than no compass at all. It might point you in a direction, but it could be the wrong one. Consider the water supply a fundamental necessity for daily life. In many Victorian cities, water was transported through lead pipes, a common historical fact due to lead's malleability and durability. As water flowed through these pipes, especially soft or acidic water, it could leach lead particles, contaminating the drinking supply. You might draw a glass of water from the tap, clear and seemingly pure, unaware that each sip carries a microscopic dose of poison. The cumulative effect of this daily exposure could lead to chronic lead poisoning, affecting entire families and communities. It's a cruel irony that the very infrastructure designed to improve public health was often a hidden source of illness. You might see an advertisement for radium water, an obscure detail that emerged in the late Victorian and early Edwardian periods, promising miraculous cures for a vast array of diseases, from arthritis to cancer. This dangerous concoction, containing radioactive elements, was marketed with glowing testimonials, playing on the public's fascination with new scientific discoveries. You might drink the glowing liquid, believing you are ingesting the very essence of vitality, unaware that you are slowly exposing your body to radiation, leading to bone decay, anemia, and ultimately, cancer. The tragic irony is that a substance believed to be the ultimate life-giver was, in reality, a silent, agonizing bringer of death. The use of lead wasn't limited to paint and plumbing. It found its way into a surprising array of everyday products. Lead was used in some cosmetics, particularly white face powders, to achieve that fashionable pale complexion. Remember that pursuit of pallor from the arsenic chapter. It was also used in glazes for pottery, in some types of glass, and even in certain food containers. You might enjoy a meal served on a beautifully glazed plate, or sip wine from a delicate glass, oblivious to the invisible poison slowly leaching into your food and drink. This pervasive presence of lead in domestic items is an obscure detail that highlights how deeply ingrained this toxic element was in the material culture of the era. The sheer audacity and inventiveness of Victorian quacks were remarkable. They employed elaborate marketing schemes, from traveling roadshows to widespread newspaper advertisements, reaching every corner of society. They understood the power of branding and the desperate human need for hope. Imagine the colorful posters plastered on every wall, the catchy jingles sung by street performers, all designed to lure you into purchasing their latest miracle cure. It's a thought that highlights the entrepreneurial spirit of the age, even when applied to the most unethical of practices. The academic debate surrounding the precise impact of lead poisoning on Victorian society is ongoing. While the link between lead exposure and various health problems is now well established, historians still debate the extent to which it contributed to the overall morbidity and mortality rates, and whether it played a significant role in the observed cognitive and behavioral issues of the time. Some argue that lead poisoning was a major, yet often unrecognized, public health crisis, contributing to everything from mental illness to crime. Others suggest that while certainly harmful, its effects were perhaps overshadowed by more pressing issues like infectious diseases and malnutrition. It's a bit like trying to untangle a ball of yarn where every thread is the same color. It's hard to see where one begins and another ends. The symptoms of relying on quack remedies were often the prolonged suffering of the original ailment, compounded by the financial burden of wasted money and, in many cases, the direct harm caused by the toxic ingredients hidden within the cures. People would spend their meager savings on bottles of ineffective tonics, delaying proper medical attention until it was too late. The emotional toll of repeated disappointment, of clinging to false hope, was immense. It's a truly heartbreaking scenario, where the very people seeking relief were exploited and left to suffer. You might observe a worker in a lead-based industry, perhaps a painter or a typesetter, exhibiting a peculiar blue line along their gums, known as a lead line or Burton's line, a common historical fact that served as a diagnostic indicator of chronic lead poisoning. This was a grim visual cue, a silent scream from the body, indicating severe internal damage. The worker might also suffer from lead colic, excruciating abdominal pain, or wrist drop, a paralysis of the wrist muscles due to nerve damage. These were the visible, undeniable signs of a life slowly being consumed by the poison they worked with daily. It's an obscure detail that paints a vivid, tragic picture of occupational hazards in an unregulated industrial age. The eventual decline of rampant quackery was a slow and hard-fought battle, driven by the rise of scientific medicine, increasing public awareness, and the gradual implementation of stricter regulations. The Pure Food and Drug Act in the United States, 1906, and similar legislation in Britain began to require accurate labeling of ingredients and prohibited false claims, slowly chipping away at the charlatans' empires. But the human desire for quick fixes and miraculous cures remains, a testament to the enduring power of hope, even when it's misplaced. You can almost hear the faint, echoing cries of the street vendors, their promises of a better life now, just a distant, hollow whisper. The sense of vulnerability lingers, a chilling reminder of how easily desperation can be exploited. The sheer volume of lead extracted and processed during the Victorian era is immense. The demand for lead for pipes, paints, and various industrial applications meant that mines and factories churned out tons of the heavy metal, often with little regard for the health of the workers or the surrounding environment. Imagine the plumes of lead dust rising from smelters, settling on nearby homes and fields, contaminating everything in its path. The widespread industrial use of lead meant that even those who never directly handled the substance could be exposed through contaminated air, water, and soil. It's a thought that makes you shudder, the idea of an entire landscape subtly poisoned by the very progress it celebrated. As the echoes of quackery's hollow promises fade into the historical mists, a new dawn, albeit a slow and painful one, begins to break over the landscape of Victorian medicine. This is the era of the fading shadows of toxic treatments, a period marked by the gradual, often reluctant, shift towards safer, more evidence-based medical practices. The journey was not swift, nor was it without its setbacks, but the relentless march of scientific discovery and a growing public awareness slowly began to dismantle the edifice of dangerous remedies and unfounded claims. The symptoms of lead poisoning were often progressive and debilitating. What might start as mild fatigue could escalate to severe abdominal pain, muscle weakness, kidney failure, and eventually, neurological damage manifesting as seizures, psychosis, or even coma. Children were particularly vulnerable, as their developing brains and bodies absorbed lead more readily and were more susceptible to its damaging effects. The slow, relentless progression of the illness meant that victims often suffered for years, their health gradually deteriorating, their lives slowly fading away, with doctors often unable to pinpoint the true cause of their suffering. It's a cruel, drawn-out tragedy, unfolding silently in countless homes. You might notice a subtle change in the advertisements in the newspapers, a common historical fact that reflects the nascent stirrings of consumer protection. While outlandish claims still persisted, the language began to shift, becoming slightly more cautious, less overtly miraculous. The sheer volume of mercury, arsenic, and opium in patent medicines, while still present, started to face scrutiny, driven by the tireless work of nascent public health advocates and a growing number of ethical physicians. It's like watching a vast, slow-moving glacier begin to turn, almost imperceptible at first, but ultimately unstoppable. The eventual recognition of lead's widespread toxicity and the subsequent efforts to curb its use were a long and arduous battle. It required pioneering research, public health campaigns, and ultimately, legislative action to ban lead from paints, plumbing, and other consumer products. But the legacy of lead poisoning continued for decades, as older homes and infrastructure remained contaminated, a silent testament to the dangers of unchecked industrialization and medical ignorance. You can almost feel the faint, heavy weight of the lead in the air, a phantom presence from an era where progress often came with a hidden, toxic cost. The metallic taste in your mouth seems to linger, a chilling reminder of the invisible poisons that once permeated every aspect of Victorian life. Imagine you are a young medical student, poring over textbooks that, for the first time, are beginning to emphasize germ theory, a common historical fact that was slowly gaining acceptance, largely due to the groundbreaking work of Louis Pasteur and Robert Koch. The idea that invisible microorganisms, rather than imbalances of humors or bad air, were responsible for disease was revolutionary. This fundamental shift in understanding began to render many of the old, toxic cures obsolete. Why purge the body with mercury if the illness was caused by a specific bacterium that could be targeted more precisely? This intellectual revolution, though slow to permeate all levels of medical practice, was the bedrock upon which modern medicine would eventually be built. As you drift deeper into the Victorian night, the metallic tang of lead and the almond scent of arsenic finally fade, replaced by a heavy, sweet, almost cloying aroma. It's the scent of comfort, of oblivion, of a temporary escape from the harsh realities of life, the pervasive, seductive, and ultimately devastating scent of opium. In the Victorian era, opium was not a clandestine drug. It was a ubiquitous presence, a common historical fact found in countless patent medicines, readily available in apothecaries, and consumed by people from all walks of life, from the wealthiest aristocrats to the poorest laborers. It was the ultimate panacea, promising relief from pain, anxiety, and the relentless grind of everyday existence. The insidious nature of this transition lay in the deep-seated traditions and economic interests that resisted change. Many doctors trained in older methods were reluctant to abandon practices they had used for decades, even when confronted with new evidence. Furthermore, the patent medicine industry was a powerful economic force, with vested interests in maintaining the status quo. You might witness heated debates in medical journals, or hear impassioned speeches at public lectures, as proponents of new scientific methods clashed with defenders of traditional, albeit toxic, remedies. It's a bit like trying to turn a supertanker around in a bathtub. It's going to take a lot of effort and a very long time. You might be a factory worker, your body aching from hours of grueling labor, your lungs burning from the polluted air, and your mind weary from the relentless noise. You seek solace, and a fellow worker might recommend a small, dark bottle of laudanum, a common historical fact that was a tincture of opium dissolved in alcohol. You take a spoonful, and within minutes, a warm, comforting wave washes over you, dulling the pain, easing the tension, and allowing you to finally find a moment of peace. The world outside seems to recede, its sharp edges softened by the drug's gentle embrace. It's like wrapping yourself in a warm, heavy blanket on a cold night. It feels good, but it doesn't solve the underlying chill. Consider the growing importance of pharmacology, the scientific study of drugs and their effects, a common historical fact that began to emerge as a distinct discipline in the late Victorian era. Instead of relying on crude plant extracts or dangerous heavy metals, scientists began to isolate active compounds, synthesize new ones, and conduct systematic studies on their efficacy and safety. This led to the development of more targeted medications, such as aspirin synthesized in 1897, which offered genuine pain relief without the severe side effects of opium or the toxicity of other Victorian remedies. You might find yourself prescribed a new, precisely measured tablet for your headache, a world away from the mercury-laced calomel of your ancestors. It's a truly revolutionary step, moving from guesswork to precision. Imagine you are a mother, exhausted from caring for a large family in cramped, unsanitary conditions. Your infant is crying incessantly, perhaps suffering from teething pain or a persistent cough. You remember the advice of your neighbor, or an advertisement in the local paper, for Godfrey's cordial or Mrs. Winslow's soothing syrup. You administer a small dose to your child, and soon, the crying stops, replaced by a peaceful, albeit unnaturally deep, slumber. The silence is a blessing, a brief respite from the relentless demands of motherhood. What you don't realize is that these soothing syrups were heavily laden with opium, and countless infants succumb to accidental overdoses, their quiet sleep turning into a permanent one. This casual, widespread use of opiates for children is an obscure detail that highlights the tragic consequences of ignorance and desperation. The academic debate surrounding the pace and drivers of this medical transition is complex. Historians still debate whether it was primarily the internal advancements within the scientific community, the external pressures from public health movements, or a combination of both that ultimately led to the decline of toxic treatments. Some argue that the sheer weight of scientific evidence, particularly in bacteriology and pharmacology, became undeniable, forcing a shift. Others contend that public outcry against dangerous quackery and the rising death tolls from accidental poisonings played a more significant role in demanding safer alternatives. It's like arguing whether the chicken or the egg came first. Both were essential to the eventual outcome. The insidious nature of opium addiction was often misunderstood or simply ignored. The initial relief it offered was so profound, so immediate, that the long-term consequences seemed a distant concern. People would develop a tolerance, requiring ever-increasing doses to achieve the same effect, leading to a spiraling cycle of dependence. You might notice a loved one becoming increasingly withdrawn, their eyes glazed, their movements slow and deliberate. They might suffer from chronic constipation, lethargy, and a general disinterest in life. Symptoms often attributed to nervous debility or a weak constitution, rather than the true culprit. It's a bit like trying to quench your thirst with salt water. It feels like it's helping at first, but it only makes you more dehydrated in the long run. You might observe the establishment of the first rudimentary food and drug regulations, an obscure detail that began to appear in various countries towards the end of the century. These early laws, though often weak and difficult to enforce, were a crucial first step towards protecting the public from fraudulent and dangerous products. They began to require manufacturers to list at least some of their ingredients, and to curb the most egregious false advertising. You might pick up a bottle of tonic and, for the first time, see a small, almost imperceptible label indicating the presence of alcohol or a specific chemical, a tiny but significant victory for transparency. It's like finding a single ray of sunlight breaking through a thick fog, a sign that clarity is on its way. Consider the widespread availability of opium in various forms. It wasn't just laudanum. You could find opium in pills, powders, and even in some confectionery. It was sold openly in chemist shops, grocery stores, and even by street vendors. There were no prescriptions, no regulations, no warnings about addiction. You could simply walk into a shop and purchase a bottle of laudanum as easily as you could buy a loaf of bread. This accessibility meant that addiction was not limited to any particular social class. It permeated all levels of Victorian society, a common historical fact that often surprises modern sensibilities. It's a truly staggering thought. A society where a powerful narcotic was as commonplace as tea. The sheer dedication of pioneering scientists and reformers was instrumental in this shift. Figures like Florence Nightingale, with her relentless advocacy for sanitation and hygiene, and the early toxicologist who meticulously documented the harmful effects of various substances, laid the groundwork for a safer medical future. Imagine these tireless individuals, often working against entrenched skepticism and powerful opposition, chipping away at centuries of medical ignorance. It's a thought that inspires awe, the sheer tenacity required to challenge prevailing wisdom and usher in a new era of understanding. The academic debate surrounding the social and medical impact of widespread opium use in Victorian Britain is complex. While its addictive properties are undeniable, historians still debate whether the overall harm outweighed the benefits, especially in an era with limited pain relief options. Some argue that opium, despite its dangers, provided essential palliative care for chronic pain, terminal illnesses, and the general suffering of a harsh industrial age, allowing many to function and endure. Others contend that its widespread availability created a hidden epidemic of addiction, leading to immense personal suffering, poverty, and social decay. It's a bit like arguing whether a leaky dam is better than no dam at all. It might hold back some water, but it's still a dangerous situation. The symptoms of a society slowly healing from its toxic past were subtle but profound. Fewer cases of mercury-induced madness, fewer children dying from opiate-laced syrups, fewer individuals suffering from chronic lead poisoning. The overall health of the population, while still facing immense challenges, began to show incremental improvements. The shift was not a sudden revolution, but a gradual evolution, a slow awakening to the dangers that had long been accepted as normal. It's a bit like a patient slowly recovering from a long illness. The improvements are not always dramatic, but they are undeniably present. You might observe a gentleman, a respectable member of society, discreetly excusing himself from a social gathering to take a dose of his nerve tonic, which, unbeknownst to many, was a potent opium concoction. His trembling hands and anxious demeanor would momentarily subside, replaced by a calm, almost serene expression. This hidden addiction, often maintained in secrecy due to social stigma, was a common reality for many Victorians. The need to maintain appearances often meant that addictions were carefully concealed, leading to a lonely and isolated struggle. This quiet, private suffering is an obscure detail that reveals the hidden costs of a society that valued decorum above all else. The legacy of the Victorian era's toxic treatments serves as a powerful cautionary tale, a reminder of the dangers of unchecked enthusiasm, insufficient scientific understanding, and the exploitation of desperate hope. While we may look back with a sense of disbelief at the remedies of the past, the human desire for quick fixes and miraculous cures remains, even in our technologically advanced age. The shadows of those toxic treatments may have faded, but their lessons continue to echo through time, urging us to approach new discoveries with caution, skepticism, and a relentless commitment to patient safety. The gas lamps of the Victorian era finally flicker and die, leaving you in the quiet darkness, with only the gentle hum of your fan and the echoes of a dangerous past. And now, as our tale of Victorian poison cures comes to a close, let the images of foggy streets, mysterious pharmacies, and poisonous drugs fade into the distance. Picture yourself lying in your soft bed, the warmth of your blankets enveloping you, and the worries of the modern world drifting away. Let your mind wander to calm rivers, moonlit lavender fields, or any other peaceful scene you can imagine. Take a deep breath, feel the cool air fill your lungs, and exhale any lingering tension. Remember, while history may be full of mistakes and scary choices, we have learned a lot. We have progressed, we have learned, and we have found better ways to care for ourselves. So rest easy. It is okay. Let these stories gently lull you into a deep sleep. Let your mind rest, your body relax, and your soul find peace. Fall asleep knowing you are safe and protected. The sheer volume of opium imported and consumed in Britain during the Victorian era is truly astounding. The British Empire's involvement in the opium trade with China, a dark chapter in history, meant that vast quantities of the drug were readily available. It's this constant supply, combined with the lack of regulation and the desperate need for pain relief, created a perfect storm for widespread addiction. Imagine the ships laden with raw opium, docking in British ports, its contents destined for medicine cabinets and back alleys alike. It's a thought that highlights the global reach of this destructive trade and its profound impact on domestic life.